Hello, today is the evening of Friday, April the 4th, and yesterday I received this in the post. A Eli Lilly quick pen containing 4 2.5 mg doses of Mounjaro medication, which is a prescription only medication in the UK and I believe in most of the world. This is the trade name or the brand name. Trizepatide is the actual medication, the active ingredient, if you will. So, why do I have this? The simple answer is because I'm fat. Now, I am comfortably in the obese category, a BMI of around about 40, but at the same time, I don't have any other underlying health concerns. I'm not diabetic, I don't have heart disease, don't have high cholesterol or anything of that nature. So, it's very unlikely that I would get this prescribed on what we have in the UK called the National Health Service, or the NHS, where you need to be both morbidly obese and have a weight-related secondary condition. This means, of course, I had to order this, for want of a better expression, via a private prescription, and I went to a company called the Independent Pharmacy, and I have to say, when I received this, it was exceptionally well packaged. The quick pen was in a bubble wrap bag. The bubble wrap bag was in an insulated plastic bag with an ice pack. That plastic bag was in a brown cardboard box, and also in that cardboard box were a box of pen needles, as you can see, and very sensibly, sharps. So let's open this up and see what we actually have. I'm going to start with the needles. Now, I had to do an online consultation form. And some people are concerned that when you go to these online pharmacies, you just get, you fill a form in, you tick a few boxes, and then they send you the medication. And it's true, the consultation is done by a form. The questions are relevant. To send a full-length photograph, including my face, and I had to go through a photo ID check as well. I have bought other medications from that pharmacy, and when they've had a review of the form, they have got back to me in the past and said, we want to just check this or that, the doctor's with something you said on your form. So there is a good degree of clinical care, and they have subsequently sent links to training videos, patient information leaflets and that sort of thing. So that's our little needle. It has a paper cap on the back, an inner and an outer protective cover. Take a closer look at that in a moment. Let's get into this box here. Now, although I've seen plenty of videos and discussions about this thing, this is the first time I'm seeing this in real life. So that's what we get in the box. A patient instruction leaflet or information leaflet. The quick pen itself. And more instructions. So what I don't have, so when I did the consultation form, you then had to click a box to select the medication out of those that effectively are suggesting for weight loss. And I clicked on this, obviously. You have to start at 2.5 mg. And they do say if you select a higher dose, having not taken it before, they will automatically reduce it to a lower dose when they fulfill the prescription. So that was pretty good. Pretty decent level of patient care there. What I'm not seeing here, so I selected that medication, and it then said to me, the website then said to me, you will need needles and a sharps bin as well, and it added those to the order at no additional charge, which is a good thing because the charge was horrific. This was £150, and I should point out this is 2.5 mg. Most people develop a tolerance to this and they have to step up to a higher dose as time goes on, and the higher doses have higher price tags. So bear that in mind if you consider going down this route. To give you an idea of what this looks like, this is a standard sort of office biro writing pen. It's a bit fatter, a bit shorter, but basically the same size. This cap comes away. So all of this here is the medication. We can see there's a plunger at the back. This is a little selector dial. So 0 means there's 0 dose selected. You can push this as much as you like and it's not going to squirt anything out. As you turn this, this will turn to number 1, which means it will dispense 1 dose of 2.5 milligrams when you press the plunger in. So let's go ahead and put a needle on this. I am disappointed there are no alcohol swabs with this product, but you do need an alcohol swab. Fortunately, I do have some, so let's grab one of those. If you're watching Independent Pharmacy, when you add your needles and your sharps bin, maybe consider adding some of these. So you need to wipe this rubber seal with the swab. It doesn't say anywhere in the instructions that I've read that you need to wipe the injection site, but I've done so anyway. I'm going to pull this paper tag away and screw it on. Now I can see straight away there is an air bubble there. So I'm going to pull away that outer cap, pull away the inner cap, and we need to prime this. So you click this once, twice, and when we squeeze the plunger we should see it eject some dosage. Try that again. Yeah, actually I can see, I didn't see it first time. Little beads of medication squirting out there. So having primed the needle, I'm going to turn this all the way much further than I was expecting actually, to number 1. It won't turn any further. And then the way this works, I'm not going to film the actual injection, but you stick it in, push the plunger down and hold it. That's what I'm going to do. If you choose to go down this route, you can do something else, you can do whatever you wish. But that's what I'm going to do. So here we go, first ever dose of any kind of weight loss type medication. The plunger down and then hold it in place for 6 seconds. 5, 4, 3, 2, 1, and put it out again. And that hasn't quite reset to 0, it was 1 click away. Now I've injected this, I'm going to put the outer cap back on for safety. There we go, and unscrew that. Put the cap, oops, put the cap on the quick pan, put that back in the box, and put my needle in the shelves bin. There we go. So I went with an injection in my upper leg, my thigh if you will, because from what I've read of the Eli Lilly tests of injection sites, you can get up to 3% less absorption of the medication injecting it into the upper leg. And why would I want less absorption? Well, because this is the first dose I've ever taken of this medication. It can have some fairly unpleasant side effects from what I've read and heard. So I'd like the softest of soft starts at this time. So that's what I've done. I've gone onto a private pharmacy. I've bought this. I was happy with the sort of level of clinical care from that pharmacy. I think the price is exorbitant. I think it should have come with alcohol swabs, which it hasn't. So that's a little bit disappointing. But we'll have to see if this works. Now, as I say, this is the first time I've used it. I will cut away now to tomorrow evening, so that will be my first day experience, and I'll let you know if I've had any side effects or any thing of interest happens in the next 24 hours. So it's now part 2 of this video. It's 24 hours later and it's the evening of Saturday the 5th of April, which means on Friday evening and Saturday evening I've been at home and not going out anywhere. So that's just a little bit sad in itself. But anyway, I took the drug, I injected it in my thigh, as you will know if you've been watching this video, and I'd like to talk about some issues surrounding that, some experiences I've had which may or may not have been side effects of the medication, and my early sort of feelings about whether it's working or not. So when I injected it, there was a fairly decent sized bead of blood. And that's got me to speculate about that injection site, which I'll come to a little bit later. Now, within about 20 to 30 minutes of taking it, a feeling came over me. I don't really have the right adjective to describe it, but anyone who gets migraines will be familiar with a sort of a feeling that washes over you just prior to getting a migraine, which is kind of an uneasiness and a slightly spacey feeling. And then, sure enough, I got the visual aura and the headache and a very, very slight amount of nausea. I had a migraine. And I took an naproxen tablet, which, now it may be that was a side effect of the medication. It may be, as I'm going to speculate later, to do with where I injected it, or it may be just I had a migraine that particular day. So that was the first thing that happened. I didn't feel too bad. What I'd like to do now is play a little game of side effect bingo, looking at the patient information sheet. So let me just get this whole thing from there to there is various possible side effects. Now, a lot of these are things that wouldn't become apparent until some time after starting a course of treatment, some weeks or months or even years. But let's have a little look. Uncommon side effects. Inflamed pancreas. No way of knowing. I doubt that would happen within 24 hours anyway. Rare side effect affecting maybe up to 1 in 100 people. Severe allergic reaction, IG anaphylactic reaction. I definitely didn't have that. Other side effects. So these, I presume, are the less serious or not serious side effects. Very common, affecting more than 1 in 10 people. Low blood sugar, hypoglycemia when trizepatide is used for the treatment of type 2 diabetes. Well, I'm not using it for the treatment of type 2 diabetes, and I'm not measuring my blood sugar level at the moment anyway. I did incidentally take, I can never remember the full name, HbA1C or something like that, a blood glucose level in January, and it was 39.8 millimoles to the mole, which, depending on which scale you use and whether it's Diabetes UK or whether it's the NHS or whether it's the American versions, either puts me at the upper end of normal or at the very, very lowest end of the pre-diabetic range. But as far as the side effect for this medication, low blood sugar if you're type 2 diabetic taking other medication. I'm not a type 2 diabetic, I'm not taking other medication. Moving on, feeling sick, well, I had a migraine, so I did feel a little queasy, but it was very mild. Diarrhea, no. Being sick, vomiting, no. Where are we? Sorry about the rusty paper. Common may affect up to 1 in 10 people. Again, low blood sugar, and not measuring it. Allergic reaction, rich itching and eczema. I get eczema anyway, so I don't have it as a side effect of the drug. Dizziness. Observed in patients treated for weight management. I have felt slightly lightheaded. Very slightly. You wouldn't even... if you ever stood up from a chair and felt dizzy, it was about 10% of that feeling. So very, very, very faint. If you weren't thinking, I wonder if I'm having a side effect from a medication, you wouldn't even notice that you're feeling a little bit lightheaded. It was that mild. Feeling less hungry, decreased appetite, observed in patients with type 2 diabetes. Now, you might be thinking, well, surely the point of this medication is to feel less hungry, but of course that's the point if you're taking it for weight management. What they're saying here is, if you're type 2 diabetic, taking it would be a side effect. As it happens, I have felt less hungry, and I'll talk about that in a little more detail a little bit later. Stomach pain, no. Indigestion, come back to that one. Bloating, no. Burping, gas, no. Reflux. Gastroesophageal reflux disease, or GORD. This is something I get anyway, and I take a proton pump inhibitor. So I haven't had indigestion or GORD because I'm already on medication to manage it. So that's a bit of a non-starter for me. Hair loss, I'm not going to notice that in 24 hours, but they don't call me a slaphead for nothing. Feeling tired, I have actually felt tired. Have I felt more tired than usual? A little bit. Injection site reactions, itching and redness. Well, apart from the bead of blood I mentioned, no, that's been fine. Fast pulse. Fast pulse, and there's also somewhere in this list fast heart rate. I'm not quite sure how pulse and heart rate are different. Initially, when I took it, my heart rate and therefore my pulse did increase, and that might be, I took some medication. I then had a migraine, and I was thinking, oh no, is this going to be my life now for the next 5 days? The half-life of this medication being 5 days. It may have been, my heart was racing a little bit because I was anxious, or it may have been a side effect of the medication itself. I don't know, but I do know, yes, I had a fast pulse for a period of time. Increased levels of pancreatic enzymes, how would I know? I don't think it's likely to happen in 24 hours anyway. Fast pulse of common side effect when taken with type 2 diabetes, and uncommon when for weight management. So it's probable it was just a little nervousness on my part, because it seems silly. I'm a mid-50s, big bruiser of a chap, but you do get anxious taking these things. It is potentially a life-changing medication. I think for some people it's potentially a life-saving medication. So yeah, hard to know what is a side effect of the medication and what is just your reaction to taking it. Psychosomatic, you might say. Uncommon, low blood sugar, well again, not testing for it. Gallstones, again, not in 24 hours. Weight loss observed, again, not going to be a case in 24 hours. Again, it's saying weight loss observed in patients with type 2 diabetes, because, again, if you're a diabetic, you're not taking it for weight loss. So if you lost weight as a result of this, it would be a side effect. It might be a side effect you're quite happy with, it might not, but it would be a side effect. Injection site pain, there we go. So I did also, shortly after taking it, have an increase in blood pressure. I wouldn't say it was a dramatic or serious increase in blood pressure. It went to the higher level of what might be considered normal for me. That being said, I went to bed about 11 o'clock, woke up, the migraine as such was gone, still had a bit of a headache. By the time I'd had my morning coffee, the headache had all but gone, just a very faint headache still, even now, very, very mild. But during today, my blood pressure has not just returned to its normal level, it's returned to a normal level for me on a good day. So, is that a result of the medication? Did it go up because of the medication? Has it come down to a low normal level for me because of the medication? Or is it just some other factor? Again, I don't know. But that's what's happened. Slightly elevated heart rate, bit of a migraine, slight headache today, slight dizziness, slight increase in blood pressure, and now that has returned to not just normal, but normal for a good day. So those have been the side effects. Now, so it caused me to speculate on the injection site. This is meant to be injected into fat tissue, and I'm not especially fat in my legs. So getting a bead of blood suggests to me that some of the medication, or possibly most of it, didn't go into fat but went directly into not a vein, or but some sort of venal or capillary type blood vessel type thing. I'm not a doctor, don't know what I'm talking about. So it may not have ended up quite in the right place initially, and that might have caused some more side effects. But even if it were, they were all very mild. Next time I take it, it will be in my stomach, which definitely has a lot of fat around it. If the second dose produces anything like the side effects or anything like the reaction that I've had from the first dose, or appear to have had from the first dose, that will be an end of it for me. I can't be taking a medication once a week that's going to cause me to have a migraine and all these other complications. Hopefully, injecting in the hopefully it wasn't a side effect anyway, but injecting it in the stomach, having a second dose after a period of acclimatization will, I hope, resolve those issues. In terms of reduced appetite, Quite often if I sit on my sofa watching YouTube videos, I will snack on various snack foods. I'll have a bit of cheese, or I'll have one of this, or one of those. Today I've been watching videos about, funnily enough, Mounjaro and other similar drugs, and other people's experiences, and I haven't been snacking in them. I did go into the kitchen at one point, and there's a bag of sugary sweets on the side, and I ate one of them. And you might think, well, I shouldn't be eating sugary sweets, and you might well be right. But in the past, and by the past I mean before yesterday, I wouldn't have eaten one of them. I would have eaten a lot of them, maybe the whole bag. So just eating one, thinking, oh, that tasted nice, and then going about my normal business was quite unusual. And again, as I've been drinking coffee, watching television, pottering about all day, I haven't been eating snacks in the same way that I used to be. Now, of course, it is only 24 hours after I took the first dose. By no means soon enough to make any kind of a determination. It might just be it's in my mind not to eat as much. You decide to take action, you buy the medication, but also as a part of that taking action, you've got to eat less, so maybe I'm just eating less. But I just haven't. A couple of times, again, I went into the kitchen and made a cup of tea, and I thought, oh, should I have another sugary sweet, or I could have a biscuit with a cup of tea. And I thought, I really just don't fancy it. It wasn't that I wanted something to eat and was resisting the temptation. I thought about having something to eat and decided, actually, I just didn't want anything to eat at that particular moment. So that was quite interesting. Will it continue? Don't know. Will I continue this medication after the second week? Don't know, because I don't know if we're going to have the same experience as I've had this week. But so far that's been my experience with Mounjaro. I have watched a lot of videos on YouTube and read a lot about this medication, and I have to say, people sharing their experiences, which is what I'm doing here, I suppose, is very useful. You can watch several people talk about their experiences, talk about what they want to talk about as they want to talk about it. It's really quite helpful. This video, nor any other video on the subject, is advice or recommendation. It's just a documentation of one's experience, how I feel about it, and some vague speculation. But again, by no means advice or recommendation or suggestion. It's just each video is just one person's experience. With that said, when I make another video, maybe, especially if I do have a similar experience next week, or I have a particularly dramatic weight loss. Haven't talked too much about actual numbers of weight because, as I say, it's been 24 hours. As I said earlier in the video, very high BMI. Maybe we'll see that come down as well. For now, thank you for watching. So until next time, if there is a next time, all the best and good health.